Please welcome our last presentation of the day, entitled The Role of Corneal Nerves in Viral Keratitis, presented by Mr. Kavindisaya Ruktaengam.
Good afternoon, ladies and gentlemen. My name is Kavindisaya Ruktaengam, and I'm from the Joint Medical Program of Sirindhorn. The title today is The Role of Corneal Nerves in Viral Keratitis, an extended literature review. So it's going to be a bit of a mini lecture, if you will. So this is my outline. Let's begin with some introduction. So the corneal nerves originate from the ophthalmic branch of the trigeminal ganglion and provide sensory and trophic functions to the cornea. Infectious keratitis is a leading disease that causes visual impairment and blindness all over the world. Degrees of damage range from corneal scarring, perforation, and endophthalmitis to loss of the whole eye. Herpes simplex keratitis by far is the most common cause of corneal blindness in developed countries. When the corneal nerves are destroyed, sensitivity will diminish and the homeostasis will be disrupted or lost altogether, giving rise to a condition called neurotrophic keratopathy. So the in vivo confocal microscopy is a non-invasive procedure used to obtain a high-resolution imaging of the cornea. It can be used to diagnose a wide range of conditions, including the non-only aging cornea, the corneal and contact lens users, infectious keratitis, and neurotrophic keratopathy. As of now, serum eye drops are the most common drugs used to treat viral keratitis. It contains 3 types of molecules. First are neurotrophic factors, such as the nerve growth factors. Second are the epithelial growth factors. And the third are some extracellular matrix, such as the hyaluronic acid. So the aim of this research is to provide an extended review on the role of corneal nerves in viral keratitis, including the pathophysiology and the interactions with corneal immune cells. This review will also discuss some novel therapeutics that aim to control inflammation and resolve the disease through mechanisms of the corneal nerves, and extrapolate to the treatment of neurotrophic keratopathy. As for the methods, an online search was performed on the PubMed, Science Direct, elsewhere, BMJ Ophthalmology, and American Academy of Ophthalmology. Randomized control trials, case reports and reviews are included, and grey literature are excluded. The mesh terms are used, and the terms used are as follows. So as for the results part, in viral keratitis, there's a significant reduction in number and density of the subbasal nerve plexus. Cellular changes also occurred, including metaplasia of the epithelial cells, which also impair corneal sensation and corneal nerve density. The corneal sensitive nerves in herpes simplex virus infection was destroyed, accompanied by the loss of corneal sensation and link reflex. At the same time, the sympathetic nerves from the superior cervical ganglion start to enter the corneal fluid place. And this can give rise to inflammation. The second finding in this study, both the affected and unaffected eyes in the herpes zoster ophthalmicus suffer reduction in subbasal corneal nerve plexus parameters in comparison to control groups. And the parameters used are the number of nerve trunks, the branches, the number of nerves, and the total nerve length. So tassography is suturing of eyelids to protect the eye from external stimuli. It helps to keep the eye moisturized and reduces tear evaporation. In this research, it was found that tassography reduces overall symptoms and inflammation of the herpes simplex keratopathy. When combined with depletion of CD4+ expression in the cornea, blink reflex was also improved. So the superior cervical ganglectomy is a surgery to remove the superior cervical ganglion, which involves retraction of homoion muscle and carotid bifurcation. In this study, during the 10th and 14th day post-infection, the surgery helps to limit the severity of herpes simplex keratitis and prevents hyperinnervation of sympathetic nerves. So corneal neurotization is a surgical procedure where healthy sensory nerves are transferred into the denervated cornea to induce sensory functions by direct nerve transfer or interpositional nerve graft. It was found that the sensation and blink reflex, along with trophic functions of the corneal nerves in both subbasal and stromal layer, were restored. In this study, the sural nerve graft and greater auricular nerve graft was reported in a clinical trial to effectively resolve stage 2 and 3 neurotrophic keratopathy. In the next paper, there are the toll-like receptor 3 in infection of herpes simplex keratitis that produces inflammatory cytokines. In a study by the human corneal epithelial cells, the NGF, the nerve growth factors, causes disease resolution by inhibiting these toll-like receptors and helps to limit the cytotoxic effects of molecules such as the LDH. It was found that NGF also causes a 50% reduction in reactive oxygen species, which is overexpressed in infection. Lastly, there's a drug called bevacizumab, which is a VEGF-A inhibitor. It has anti-angiogenesis effect used to treat neovascular diseases. And in the case of herpes simplex keratitis, it just found to inhibit the sympathetic nerve growth and allowed sensory nerve to be going back in the corneas. So in conclusion, this study has given the in-depth knowledge that the virus can exacerbate latency in the corneal nerves during herpes simplex keratitis and certain ganglions. Upon reactivation, the nerves are destroyed and the virus was released. These sympathetic nerves allow transport of the previously latent virus along with inflammatory mediators to the cornea. No other forms of keratitis is seen with this phenomena. So the surgical interventions that are proven to be effective include tassorrhaphy and neurotization that aim to promote sensory nerves to be regrown back. And no medical therapies are the nerve growth factors that hinder the overactive inflammation from toll-like receptors and the anti-VEGF, which inhibits neovascularization. So treatment of viral keratitis by targeting of nerves and neurotrophic factors, when combined with traditional treatments, may allow for a holistic and individualized therapy. Thank you.
Thank you for educating us all. So, do we have any questions of our on-site judges?
Yes, I have a question that how many study that you review, and did you classify that, because in the objective you say that you would like to compare the novel therapeutic from the current with the past, right? So yeah, please explain your methodology.
Thank you for the question. So initially, my advisor, the professor, we discussed that it would be better for me to do a lit review instead of systematic review because it would allow for a direct comparison between studies, and also because of in this field there isn't as much per se trials in the human yet, so we're more focused on the in vitro trials. And yes. Yeah.
But I heard that there are some studies that do nerve graft, right? Are those studies clinical studies?
Yes, I've included both trials in humans and in the movie in models as well.
Okay.
What is your plan? I mean, the further plan for this topic. I mean, you will be continue to do the research in this area, right?
Yes.
Because it's quite a basic science, and I just would like to know what is the next step of this research that you will do in this area.
So originally, this project was divided into two parts. I have a partner in the UK that's doing focus on bacterial keratitis, and our advisor, he proposed after some more data collection, we will combine our works.
Thank you so much. Do our judges in the online platform has any comments or any questions? Thank you so much.
Thank you.
This is the end of the oral and poster presentation for today. Also, we are so excited to inform you about the QR code shown on the screen. There are the limited amount of special gift at the registrar's desk at the first floor for your comments, which are very meaningful support for us. Next, for anyone who is interested in the Payathai Palace visit session at 5 p.m. till 6 p.m. or welcoming reception sessions at 6 p.m. to 8:30 p.m. or both, please feel free to ask the staff for more details. Thank you for today. Thank you so much.